welcome everybody to Everyday Celebrity Media News. It's been a minute. This is an informative live news show. I'm here with a special guest, a little co-host. You want to introduce yourself?
Yeah, sure. I'm Juliana Chase. I'm a PhD student here at UC Berkeley and joining Jordan for this conversation. Excited to be here.
So we are going to talk about today about depression, addiction, and basically everything in between. And for that, we have a special guest who specializes in these topics, Isaiah Cruz, and we are going to bring Isaiah in. Isaiah, welcome.
All right. Well, thank you. Thank you so much for having me. I'm excited to be here.
That's a live studio audience, by the way.
All right.
So, tell us about yourself.
Yeah. So like you said, I do addictions. I'm a board certified psychiatric mental health nurse practitioner. I've been doing addiction medicine for the last 6 years. Anything from opiate addiction, including heroin, cocaine, meth, stimulant addictions, food addictions. Most recently, I've been doing alcohol and pornography addictions.
Alcohol and pornography?
Yeah.
So I got a lot of questions about that, but
yeah.
Where are you originally from?
Ohio. Originally, I moved to Indiana about 6 years ago for after I graduated nurse practitioner for a job.
And how long was schooling for you?
Total about 8 years. I started as a nurse, worked in emergency rooms, ICU, kind of everything all over. And working in the ER, the hospital I was at had a psychiatric dual diagnosis center. So people will come to the emergency room to help detox in acute psychosis. And as an ER nurse there, I got my first exposures to psychiatric patients and patients with dual diagnosis. And I kind of liked it. I like the patients. I like the helping people in the most desperate times that they needed it. So when I finished nurse practitioner program, I went in straight into addiction medicine and OBOT, they call it outpatient opiate addiction clinics.
What school did you study?
I went to Ohio University for my undergraduate, and then Wilkes-Barre University for my graduate degree.
So you said, does your family have a history in this field?
Yeah. Yes. My maternal grandfather was an alcoholic, and my mom has a lot of stories about him being abusive. It's just not a good situation. He died in his early 50s from cirrhosis of the liver related to alcohol abuse. So growing up in that environment, my mom kind of scared me away from alcohol, just telling me all these horror stories. So I just stayed away from alcohol because I knew that it would break my mom's heart if I came home intoxicated. So it was always kind of put the fear of God in it for me.
So you never drunk?
I drink alcohol casually. I'm not a huge fan of it. Just in general, I'm not opposed to drinking, but I'm also not a huge fan of it. Realistically, it just gives me crazy amounts of heartburn. Anytime I drink, it just blows me up. So I'm like, I don't like it.
So you said you were studying this and you liked the patients that you were dealing with. Did you find like a bond? Did you have like a lot in common with these patients? That's why you grew to love studying?
Absolutely. So I always say I'm only 2 or 3 bad decisions away from being on the other side of this. Most of the people are just everyday people who've made a couple of decisions that they regret, and now they took them down a path that they didn't like. Statistically speaking, the addicted patient has a higher IQ than the average person in society, which is completely what we don't think. You think of an alcoholic, you think of the drunk guy on the street corner begging for money. That's not the case. The average alcoholic actually has a higher IQ than the general population.
Why is that?
That's a good question. Nobody really has specifically nailed down the reason why. There's a couple of theories that the amount of stress, the high achievers, the amount of stress they put themselves under, then they use alcohol to cope with that stress, to relax, to unwind after business owners and leaders in their industry. They just push themselves so hard that when they need to relax, they turn to a substance.
Does alcohol do something to the brain to make people smarter?
No,
When you say
no.
IQ, are you talking about intelligence?
Yes, yeah, just a general IQ score. Yeah,
Ah,
It's pretty correlational, though, I would think.
okay.
Right?
So when did you finish schooling?
So 2016 is when I started, finished the program, started working at an addiction outpatient clinic, doing opiate and alcohol addiction, both, mostly opiate. Worked there in person up until COVID, and then I transitioned to an at-home position and doing strictly alcohol addiction, and then most recently started treating pornography addiction with medication. And I usually get a couple of eyebrows raised when I say that.
Yeah.
I'm curious about the medication that you're
Yeah.
prescribing.
Yeah, so it's a good medication. So there's two of them that we use. Naltrexone, which is FDA approved for opiate and alcohol addiction. And most people know it for those two. It's used off-label for pornography addiction and gambling addiction. How it works in three different ways. One, it helps to make a person less impulsive overall. And then two, it reduces the intrusive thoughts about pornography. And then three, it reduces the endorphin release from external stimuli. So typically the next follow-up question I get was, well, does it affect the dopamine release from having sex or from hugging family members or from working out or the fun things like that? You're supposed to. Short answer is no. It's the idea of using it with pornography is kind of like Pavlov's law of when a person knows they're going to watch porn, they open up their laptop, they grab their phone or whatever, their brain already starts to release dopamine. They already start to release those endorphins because they know what's coming. The naltrexone shuts that down so that snowball effect stops before it even starts. And that's how naltrexone works. It does not affect the libido. So that's really our kind of fan favorite because it doesn't affect the libido. And then the other one is citalopram or another one is sertraline if you're allergic to that. It's SSRI, very common antidepressant medication. Use it for pornography addiction for two reasons. One, it'll help reduce the anxiety related to withdrawing or stopping pornography. And then the second reason is it does cause sexual dysfunction. So a decrease in libido. So if a lot of people who are single, not in a relationship, that isn't a concern for them, oftentimes they will choose to go that route, or you can combine the two and go that route as well.
Now, when you say like porn addiction, like I'm saying everyone watches porn, but how does one know that they're addicted to porn?
Yeah, that's a good question because you have, and it depends on how.
I mean, I watch porn, and
Yeah.
I sometimes masturbate as to like release stress, so I can like I'm calm now.
Right. Yeah.
But I don't do it like I don't think I'm addicted. So how does one know that they're addicted to pornography?
It depends on how you define the word addiction. So I define it as doing something that affects you negatively, wanting to stop, and being unable to stop. So if you view pornography as okay and you're comfortable viewing it monthly, weekly, whatever, that's fine. There's people who view it every day who doesn't see that it's harming them. Now there's some underlying issues with pornography that can harm somebody, and whether or not they realize that or not, it can still be an addiction. But oftentimes I treat people who watch porn once a week or once a month or even less, and they still consider themselves addicted because they want to stop. Oftentimes they're either the common scenario is a religious person, somebody of faith. Most faiths that I know of kind of frown upon pornography. The common scenario is somebody who's religious or even a married person um, watch porn once a month, feel horrible about it, feel guilty, feel like a hypocrite. Yeah, like, I should not be doing this. It's against my morals, against my religion, whatever. They just swear they're going to stop. They stop for a week, 2 weeks, a month, 3 months. Then they use it. Then they have a porn binge for a week or a weekend. And then the cycle starts all over again. They hate themselves. They feel guilty. They feel like a hypocrite. They swear they'll never do it again. And then, 10 years down the road of doing this, that really just beats up your morale, your self-esteem. How are you ever going to stop this? Now, medication's not for everybody. Therapy is the gold standard.
I don't mean to interrupt you, but isn't that more so as like a problem with their religious beliefs? Because what you just said, they feel bad, they feel like a hypocrite when they watch porn.
Mm-hmm.
But watching porn is not a bad thing. So you shouldn't feel bad about watching porn. So
Right.
Isn't that more of like, there's something wrong with your religious beliefs? Or like if you're a fucking Catholic or something and the Catholic Church tells you porn is bad, but porn is not bad.
Right.
So
well,
why should a person take medication? I think they should just change their fucking religion, yes?
Yeah. So then this brings up a whole new topic of, is porn bad? I'm not here to say yes it is, no it's not. That's not my job. That's what each individual has to decide for themselves, whether porn is bad. Now, what I can tell you is porn contributes to the sex trade. Consent with porn is pretty in the gray area as far as the actors and actresses. Are they being coerced into consent? Are they doing it out of desperation for financial gain? And then that kind of borders on prostitution. And then supporting the porn, like for example, Pornhub. It's free, but so is Google. They make billions of dollars as well. Then you're supporting the exploitation of women. And then we have violence against women. 9 out of 10 porns have violence against women or aggression towards women. So then like, that's kind of like, is it right? Is it wrong? I don't know. Again, you have to make that decision for yourself. That's not my job to tell you what's morally right and morally wrong.
Mm. So you said when people porn, right? When they're like, okay, well, maybe it's bad for me, that's why I'm addicted to porn. And then when you transfer porn to like alcohol or drugs, and if a person is, let's say they're drinking a lot compared to the next person, but they don't think they drink a lot.
Yeah.
So how do you determine if this person has an addiction with alcohol when they feel that what they're doing is not harmful to them, but their friend thinks that, okay, yeah, you are an alcoholic?
Yeah, that's not an easy question to answer either. So it goes back to, there are some objective scales, like it's called a CWA scale. It's ask the patient, like, do you need a beer or alcohol first thing in the morning to keep away withdrawals? Has more than one person told you that alcohol is bothersome to you? And have you felt guilty about drinking or how much you drink and things like that? Those are some kind of objective. It's not a perfect scale. It's very individualized, but those are some of the cues that a person can be addicted. Also, risk factors, risky drinking. Do you drink and drive? Do you drink and take care of children or operate machinery? Do you often black out and wake up and not know what happened? Those are all risky behaviors that, sure, it's not harming you yet, but eventually that something bad's going to happen, whether it be drinking or driving or blacking out. So that it's on a path to being destructive to your life. And then the health goes with alcohol. Your liver enzymes, everybody knows alcohol is hard on the liver. So generally, you don't start seeing the signs for alcoholic fatty liver disease until it's already progressing, because the liver is one of the only organs that can reproduce or regenerate itself. So then alcohol also causes esophageal erosions, stomach lining erosion, and it can cause anxiety And because alcohol is often used for anxiety, like I said at the beginning, people will drink because they're anxious, drink because they can't sleep, because alcohol is a pretty decent anxiety medication. It just comes with a lot of side effects. So with alcohol chronic use, you get up and down in your anxiety. So as the alcohol wears off, the anxiety comes back and comes back even worse. And so you drink some more, and then that takes care of the anxiety. And then it's just that up and down cycle with anxiety and depression with alcohol.
Alcohol is a natural depressant, correct?
Yeah. So it stimulates the relaxation neurotransmitters in your brain. It's called the GABA receptors. They're responsible for just general feelings of relaxing, and it can put you to sleep. It can help to numb the pain, help numb anxiety, make you feel content.
Mm. I don't know if you studied this, but I haven't studied it, but I was just asking the question. Do you know any statistics of, like, America, for example, people diagnosed being alcoholics than other countries, say like London? I don't know if you've ever been to London, but when I went to London, they started drinking at like 9 o'clock in the morning. That was normal. The bars were open at like 9 a.m. And you go in there, you get a beer, and it's like the size of a gallon of milk or something. That's normal. But out here, drinking that early in the morning is not normal. But alcoholism in America is very high. I don't know the rates in other countries, but I would assume that if people are drinking in London, and if that's the culture to start drinking like early like that, and everyone drinks, like when you're walking around in the street, people are drinking out in the street and everything. So I would think this will be a problem in countries like that. But when out here, it's more, what's the word I'm looking for? It's more policed.
Yeah. I don't have a whole lot of insight on that, but again, it goes back to how a person will define addiction. With alcohol addiction, you kind of have two addictions. You have your physical dependence on it, and then you have your psychological addiction to it. So people who drink early in the morning, they need to drink because they're starting withdrawals. Well, that's a physical dependence, and it may or may not be an addiction. It could just be a dependence. And then you have your psychological addictions, and then again, the harmful effects is from your body as far as alcohol goes.
And maybe even this third one, right? Like the society and what society thinks is the social norm.
Yeah, absolutely. Yeah. Society kind of frowns upon us in America, us drinking at 9 a.m. It's kind of frowned upon. In other countries, it may not be.
Yeah.
When you prescribe, you can prescribe medicine, correct?
Yes. Yeah, that is correct.
When you do you get a lot of patients who are like teenagers for addiction?
Yes. Yes and no. So when dealing with minors in medicine, it's a very gray area because they're still considered pediatrics. You have to get their parents' consent and all that stuff. Most companies stay away from it just because of the red tape and the liability and all of that stuff. So, but we do. When I first started, we started treating kids at 16 and up for heroin addiction. After about a year of working at that company, they put a stop to that. Again, above my pay grade on why they put a stop to that. I'm assuming malpractice insurance and stuff like that. But we do get a lot of requests for parents to come help my teenager. I found out they're doing heroin. I found out they're drinking. And especially when I worked in the emergency room, parents would freak out. They found their kid doing drugs, to bring them to the emergency room. You got to help them. And there's only very few pediatric inpatient addiction centers in general. So it's a whole, it is a very serious problem. And there isn't a good solution out there for the pediatric patient.
How would one treat a 15-year-old addicted to heroin? What's the difference between treating that 15-year-old than treating a 39-year-old? Is the same drug dosage the
Yes.
same, or like what's the difference?
So typically, in the medical field, 12 years old is usually considered the adult dose, because by the time you're 12, medicine is a dose at 150 to 160-pound male and 120, 130-pound female. So again, this is America. Not a whole lot of people fit in that category. But as far as medicine goes, once you hit 12, 13, you start dosing at adult doses. So as far as medications goes, there's really no difference. But as far as therapy goes, it's very individualized in addictions anyway, based on their support systems, whether especially with teenagers, you want to be as aggressive as you can, and provide them with the best support as possible.
I was going to ask you something about that because you said that you are prescribing medication for people that have addiction. I feel like that's also people, you mentioned earlier too, that people are using these addictions as coping mechanisms for anxiety or anything else that they have, which is like a one-shot thing to try to cover up some sort of imbalance that they might have in their life. And now you get the medication, which is also a one-shot thing. Are you prescribing any sort of therapy like CBT? Is there any evidence for anything else that's successful with medication to combat that?
Yeah, absolutely. So, therapy is the gold standard for addictions, for almost every addiction that I know of. Therapy, medication, I always tell my patients, is a tool. You still have to do all the hard work. It just so happens jobs are easier when you have the right tools for the right jobs. So, typically for addictions, you hit the nail on the head. CBT is the gold standard. More recently, motivational interviewing has really shown a lot of evidence in supporting the addicted patient.
Can you describe what motivational interviewing is? And maybe
Yeah,
also CBT if our audience doesn't know.
yeah. So CBT is cognitive behavioral therapy. It's kind of the gold standard. It helps to change a person's views on how they think and how they think about themselves and think about a problem. So then motivational interviewing is another type of therapy, and it's a therapy used. The therapist, you really have to be trained in it. When you get a good motivational therapist, the idea is to do this. Um, you never tell the patient they're wrong. The patient is, you use the patient's words to create an ideal situation and show the patient how their values are contradicting their actions. So, for example, go back to the pornography and the religious person. The therapist will talk to him about, you describe yourself to me. You are, I describe myself as a religious person. I describe myself as this, I describe myself as that. Now, would you say that somebody who watches porn is a morally upright person, falls into your religion? Well, no. And then they can kind of see the dichotomy of their, who they want to be and who they are being. Now, that's an oversimplification of it. It gets a lot more complex, but that's kind of the idea behind motivational interviewing. You allow the patient to come up with that right answer.
What do you do when that doesn't work?
That's a good question. So whether or not it works, it's going to be up to the therapist to decide on, this isn't working. And that's okay, because there is not one route to recovery for everybody that's going to work right. So get into motivational interviewing the therapist. Yeah, really isn't working. Let's transition to something else. Let's go back to CBT. And it's going to be very individualized based on the person and the scenario that's and how comfortable the therapist is with the different types of therapy.
Mm. Have you ever misdiagnosed someone?
Yeah, absolutely. So one of the most, in my experience, one of the overdiagnoses in the mental health is bipolar, and because everyone's like, "Oh, I'm bipolar," and I find it to be overdiagnosed. Bipolar is it's kind of a, mood swings are normal for humans. That's part of being human. You have good days and bad days, good weeks and bad weeks. Doesn't mean you're bipolar. But yeah, short answer is yeah. And medicine isn't an exact science. They call it a practice for a reason, because it's a practice. It's not, especially mental health. With some of the physical health stuff, I can do a blood test and tell you exactly, yeah, you have diabetes, and I can tell you how bad it is, and I can tell you exactly how to treat it based on your blood work. With the mental health world, It's not that simple. It's a very subjective based on how the person answers your question is how you're going to formulate your diagnosis.
Do you think the medical field has lost its way? Back in the day, drugs were not like a big deal. It was more like, oh, we're going to get you help. We want you to get out of this hospital, blah, blah, blah. Nowadays, you have all these big billion-dollar companies. They create a new pill on the market. Their representatives go to these hospitals, talk to these doctors. Oh, we have these new pills. Can you test them out? Doctor has a case of pills now to get rid of. A parent comes in with their child. Oh, my child is hyper when he comes home from school. He won't sit down. I think he has autism or something, or ADHD.
Right.
But no, the child is just 5 years old and he's just full of life. And
Right.
then the doctor misdiagnoses the child, and now the child is taking all these pills. And now, as he gets older, he has an addictive personality. Now, I'm not saying this is how it always goes, but there are examples of that, because in the school system, when you have a mentally, what's the word I'm looking for? When you have a mentally ill child, the school gets more because he has a special needs. I don't know if you know that, but that's in California, I believe. And a lot of school psychologists misdiagnose children, especially minority children, because the schools get more money. And also in hospitals, I feel like hospitals want you to stay sick and get addicted to certain pills and stuff like that, because if the field does what they're supposed to do, which is to cure everyone, won't they go out of business? If everyone's getting healthier and better, why will we? I mean, we'll run out of business. No, we have to keep these people sick and dependent on what the fuck we have, so we can still have customers. How do you feel about that?
So that's let me make sure I got your question right. The three things you got: big pharma,
Yeah.
misdiagnosing children, and then hospitals as far as keeping their patients.
You can
Yeah.
probably
So
throw insurance into that too.
I'm sorry, I missed that.
You can probably throw insurance into that too if you want
Insurance.
to.
Oh yeah, yeah. So big pharma and throwing pills at people. You talk to 100 different people, you'll get 100 different opinions. I think obviously there is something not right about it. I don't know enough to elaborate on it, but I also think it's our culture, and it's our culture that as Americans we want a pill to fix our problem. We don't want to do the hard work. We don't want to go on a diet and work out every day to lose weight to prevent a heart attack. I'd rather take this pill to prevent my blood pressure than actually do the work to get healthy. So is it a cultural problem, or is it a big pharma problem, or did the big pharma uh, cause a change in the culture? Who knows? Like chicken or egg? We don't know. I know as far as opiates and pain pills, Japan has a lower addiction rate because Japanese society is okay with pain. They don't need in American society. I'm in pain. I need a pill to take away my pain. I don't like it. In other societies, they're okay with pain. They understand pain serves a purpose for your body. It's telling you, hey, something's wrong. So what do? They fix the problem. They don't just numb it. So that's another area. But yeah, was it big pharma, or is it our culture that causes that pill craze? Then the second thing is the overdiagnosis of ADHD in our school systems. Excuse me, right up there with bipolar's ADHD as far as being overdiagnosed or misdiagnosed. You're right in that, but again, it goes back to a lot of the stuff is subjective, and by the time a parent gets to a psychiatrist and says, "I'm losing my mind, my kid is driving me crazy," so you have to take their word for it, because this parent is seeking out help. Are you going to help the parent, or are you just going to not believe the parent and say no? I believe he's just a normal hyper kid. There's nothing wrong with him. Well, yes and no. You kind of have to believe the adult in the situation, and we do have scales. There is ways to measure if a child ADHD scales. Again, they're not perfect. A lot there's some objective data, but most of it is subjective. And then what's causing this spike in ADHD? Is it increase in screen time? So and in television, so back in the 80s, 70s and 80s, Mr. Rogers, his show specifically started out with short pauses, and by the end of the show, he had long pauses in between his sentences. Why? So he could help children increase their attention span. Did that specifically. So if you and I right now try to watch a movie from the 90s, it's so boring. Everything's so slow. I'm like, come on, get to the point, get to the point. Our culture has programmed us to constantly need to be entertained, and is that what's causing the increase in ADHD? Again, chicken or egg, I don't know. And again, I don't really, that's not necessarily my specialty. I don't know enough to say, yes, definitely this is what it is. And yes, they're overdiagnosing. And are there people probably overdiagnosing to get money? Yeah, probably. I'd like to think that most human beings aren't that going down that route, and most people are good, decent people.
You got a lot of
But then,
faith in the race, huh?
yeah, gotta. I try. And then the third one. What was our third topic?
Insurance.
Insurance and hospital stays. Yeah. So I worked in the hospital. I worked in the hospital for 5 years, and I would say the opposite is true, because they're sending. And it's all based on insurance, their reimbursements. The insurance will say, "Oh, you have pneumonia. We're going to pay you X amount of dollars." So now the hospital has to get this person better and out of their door before this money runs out. And then they so much so they created the bounce back. Medicare has a bounce back law now. So if this patient gets readmitted within 30 days for the same diagnosis, that hospital's not getting paid anymore because you didn't do a good enough job treating them. So I would like, and that I would say the opposite is true. The hospitals back in the 60s, you got pneumonia, you got a 2 week stay in the hospital. Now you get pneumonia, you get a 1, 2, 3 days tops. You get you better and out the door, and everything can be done from home health, telemedicine now. So, but then that goes back to the insurance companies driving the patient care, which is I'm not a huge fan of.
And I think, yeah, sorry, I know that was just long-winded. Thank you for answering all that question. But I wanted to get back to a little bit of your practice and how you treat patients and how you even get patients. So you're outpatient right now, but you've also been doing like telemedicine. Do you get referrals from hospitals from patients that are maybe in psychiatric care there? Or is this something that insurance covers for most people? How do people access your care?
Yeah, so the pornography addiction, it is telemedicine, strictly telemedicine, and we don't take insurance, and it's strictly we get referrals from just social media and Google. There isn't a whole lot of porn addiction is still kind of taboo, and not a whole lot of people say, "Yeah, I watch porn and I masturbate." Let alone say, yeah, I kind of have a problem with it. Like I do it every day. Like, yeah. So the fact that you said you watch porn and masturbate, like it's like,
I do it once.
no, I respect that. I respect that. 98% of men have watched porn in the last 6 months. How many of those will sit there in front of everybody and say, yeah, I've done it? Yeah, not many. So, and in order for this to be socially talked about, we have to talk about it, and we have to get it out in the open. Say, hey, and there are people who have problems with it, and we treat people who have, I watch porn all day, every day, can't stop. I watch the illegal stuff, all the way to the person that I talked about in the beginning who watches it once a month, and everything in between. And it's to the point, like I said, it depends on how you define an addiction. It gets a little gray with non-substance addictions like gambling, pornography, cell phone addiction, stuff like that. But yeah. So did I answer your question?
You did.
Yeah.
So another question for you.
Sure.
So, like, there's this whole like social media craze, right? You got Instagram, Snapchat, like OnlyFans. Are you seeing? Have you been seeing a rise on depression with teenagers because
Yeah,
of
that's a
like everything in social media?
yeah, that's a good question. I wouldn't say I don't know enough to give a definitive answer. Depression in teenage years has always been an issue, um, but with the rise in social media, it's your life is out there for everyone to see, and your self esteem is based on how many likes you get, and that's a tough world to grow up in. Luckily, I'm old enough where I kind of miss that. I miss that a little bit, so I didn't have to deal with that. But yeah, so it's definitely affecting a person's depression, anxiety, and social isolation, and community being accepted into of one's peer group. Yeah, so I don't really necessarily have a good answer for that.
What do you think is the like the number one problem? Like the number one drug people get addicted to?
Oh,
Well,
that's
not
an
even
easy
drug.
one.
What's the number one addiction? Do you think that's out there?
Number one drug people are addicted to is caffeine. 80% of the world is addicted to caffeine. Now, is that a harmful drug? Probably not. Let's be honest. It doesn't cause very many long term effects. And then, as far as I think you're talking about illegal hardcore drugs.
Yeah.
So, heroin is really taken over as king as far as causing overdoses and lethal overdoses. You can overdose on stimulants. It's not as common, but it can happen. And then benzos would be the second as far as causing overdoses, and that's really what people uh, a lot of the statistics count, because that's what matters. You can't come back from an overdose, a lethal overdose. You can be addicted to cocaine for 20 years and get better, but once again the risk of overdose is less. But with heroin, uh, once you have that lethal overdose, there's no coming back. So
So I'm the type of person, if I try something and if it's nasty or it feels bad, I won't try it again. Because like
yeah.
if I tried a cigarette for the first time, the feeling of smoke going into my lungs, it doesn't feel good. So I would never try cigarettes again. So I would never be addicted to cigarettes. Why do you feel people get addicted? So like let's say like cigarettes for example, there's people who are addicted to nicotine, and there's people who are addicted to heroin. I'm pretty sure the first time I never tried heroin before, but I'm pretty sure the first time you do heroin, it doesn't feel. I mean, well, it might feel good, but I'm assuming it doesn't feel as good as like the 10th time you do it or anything. So, what is it about these things? Do you think people will continue to do it to become addicted?
Yeah, that's a good question. There's a couple different ways people get addicted. It's I've treated thousands of patients, and I've heard the same story several times. I've tried. I was smoking weed, and I got this from a new guy because my dealer was out, and it was the best weed I've ever tried. And then I started going through withdrawals when I stopped, when I couldn't get it from him anymore. Well, he laced it with heroin. And same thing with cocaine. I did cocaine. It was the best cocaine I've ever had. And then all of a sudden they're in withdrawal because it's laced with heroin. And then oftentimes people will be at a party and it's peer pressure. Okay, I'll try it. I'll try whatever one time, right? It's and then you said the opposite is kind of true. I've never done heroin myself, but treating hundreds and thousands of patients, that first buzz is what they're chasing. That first time they do heroin is you get the best dopamine release, the best buzz you can have. The rest of your entire life you're chasing that, and you're never going to get it again, because it's your body's first exposure to it, so it releases the highest amount of dopamine. And then from then on, so the with most addictions, substance addictions, It goes like this: the first month to 3 months, 6 months, you're doing it because it feels good and you're getting a buzz, you're loving life, and then after 6 months, you're doing it to stay out of withdrawal, especially opiate withdrawal. Opiate withdrawal, it makes you feel like you want to die. You're just sick, flu-like symptoms, worst flu you've ever had. So by the time 6 months rolls in, a year rolls in, people are just doing heroin to stay out of withdrawal. They don't even get high anymore. I'm just doing it so I can stay out of withdrawal and can function in my life. You have functioning heroin addicts, but typically, eventually, they only last for so long before the addiction consumes them.
Have you ever, so like a person who does maintenance, right? And in order to, my refrigerator is broke. In
Mm-hmm.
order to know how to fix a refrigerator, you got to know how the refrigerator works, right?
Right.
Have you ever had the desire to try any drug so you can know the how to treat your patients better? So like when your patients say, "Oh, I'm addicted to this drug. It does something to me," but you honestly you don't know how it actually feels because you never
Right.
tried it before. Have you
Right.
ever had a desire, you know what, maybe I should try heroin or maybe I should try cocaine to honestly know or to be more in depth with what these people are talking about so I can know to treat them better?
Right. Yeah, no, that's a good insight. And a lot of patients will ask, "Are you an addict? Are you in recovery?" Because it's a phenomenon that the addicted patient has more respect for and wants to be treated by somebody who's been in their shoes. If they know that you're in recovery too, they have so much more respect for you. And like, okay, this guy knows what he's talking about. Which I would argue, I mean, yeah, I get that and nothing against that, but that doesn't necessarily mean that that person's what's best for you. If I'm a car mechanic, doesn't mean I have to own a car. I could be never drive a car before and still be really good at fixing cars. That doesn't necessarily mean, because I've been exposed to thousands of heroin addicts. I kind of know what heroin does. I know what heroin withdrawal looks like and the common symptoms of it, as opposed to one person who knows what it's like. They know what it's like for them, but it might be different for most people. So I get what you're saying, and a lot of people think that way, and I respect that. There's nothing wrong with that. There's a lot of therapists and people in my shoes who are in recovery. Not very many people go into addictions because they go to school for 8 years to say, yeah, I do want to work in addictions, without some type of history in it, whether it's themselves, a family member. Addiction has touched their life in some way that they say, you know what, I wanna do this.
I think sort of touching on that a little bit, just briefly, you're really vulnerable with us when you shared that story that was personal about addiction in your family.
Mhm.
And something that seems really prescient to me is that you probably have to, I mean, you hear these stories daily that cause, they're horrible stories, I imagine. I mean, addiction does a lot of things that really mess up a lot of lives and a lot of lives that they touch. How do you maintain a level of empathy that feels appropriate and also still being present with each individual that comes before you? If that makes sense. Like, how do you balance that, I guess?
Yes, it is hard because it is easy to get callous to, especially with that the population, because our society looks down upon heroin addicts so much, and really any type of drug addict. Our society treats them lower than dirt, and it's sad. And it's easy to get that, especially especially with heroin addicts. The treatment is Suboxone, which has a street value. So a certain percent of my patients come to me to get my drugs to sell on the street. I know that. And so I have to figure out which ones. I do my best to try to figure out which ones are doing that and straighten it out. But at the same time, I have to put myself in their shoes. And that's kind of what I came up with, that phrase early on in my career, that I realized kind of just hit me one day. This guy's just like me. I'm a couple of bad decisions away from being on the other side of this desk. One of my patients who, him and I grew up in the same state. It's not exactly the same town, but we grew up similar lifestyles, and because of XYZ happened to him, and he went down that road, and I realized that could have been me. Like, how many times have I've had an opportunity to go down that road, and just by the luck of the draw, I didn't. I chose not to for whatever reason. So that's kind of how I ground myself when I feel myself, because there are times in my career that I felt myself just getting less empathetic, and I kind of that's why you just have to take a step back. I've worked for a couple of places, and a lot of them have very generous vacation packages because there's such high burnout in addiction medicine. Because it's hard, and that's when you just take a couple of weeks of vacation, recenter yourself, and try to get that empathy back. Good question.
So what does the therapist do when they get depressed? Or did
Oh,
you just say you travel?
no, no, no. So everybody,
What does the therapist do? Do you prescribe Prozac for yourself?
yeah. Hey, I am a big fan of everybody needs a therapist. Even therapists need a therapist. And there's actually a subsection of therapists who treat therapists. That's what they do. They are therapists because therapists get depressed too. And life happens to therapists. Family members die. Life happens to the therapist just as much as everyone else. So everybody needs a therapist, and there's no shame in therapists, and there's no shame in antidepressants if you need it.
You have any last questions?
No, I think I'm okay.
So this is the last question. Well, not last. Tell people where they can go, or if you know any places like websites or anything,
Mm-hmm.
if they want to seek help with addiction or depression or anything like that.
Yeah. So addiction, the governing body is SAMHSA. You just type in SAMHSA in the internet, you'll come up with. They have a directory of all kinds of almost every type of addiction. You can find help there. You can call 211 in the U.S. That'll get you help as well for both addiction and for depression. Places I work, no dash the word no x.net. That's for pornography addiction, and then RIA Health, RIA Health, for alcohol addiction. Those are the places that I work at. But like I said, 211 will get you help with just about anything mental health that includes addiction.
And when it comes to porn, how many times a day is bad to watch it?
There is no good answer. Yeah. So you just, there's no good answer for that one.
All right, Isaiah. Well, I appreciate you coming on, sharing your knowledge on my platform. It was very informative. And just thank you for coming on and what you do.
Yeah, thank you so much for having me. It was fun. I love doing this.
All right. And do you have a social media or anything? Are you doctors allowed to give out your social media?
Yeah, so the NoX is the company I own. Actually, I'm the owner. So no-x.net. Social medias are NoX telemedicine. You'll find us.
Okay.
Mm-hmm.
All right, Isaiah. Thank you, and good night, sir.
Yes, thank you. Good night.
Well, how do you feel about that?
Yeah, it was informative.
Yeah.
It was helpful.
All right. Well, that was Everyday Celebrity Media News, and stay tuned. Also, you see these hats? The Everyday Celebrity Media Company hats. Go to the website. Check out the merch. Only $40. Support the machine. And I am done.